My name is Barb Johnson-Giese, and I'm the Behavioral Health Coordinator here at Door County Medical Center. In Door County, the rate of suicide is 17.3 persons per 100,000 individuals, and unfortunately, the rate in Door County is higher than both Wisconsin and the nation. People are more susceptible to suicide risk who may have significant health problems. They have mental health or substance use disorder issues. There can also be social factors. LGBTQ individuals are at higher risk than their non-LGBTQ peers. Veterans are approximately 1.5 times more likely to die by suicide than their non-veteran cohorts. The first sign is that if someone says that they want to die or do not want to go on or are thinking about killing themselves, that obviously is a sign. Some people tend to isolate and they change their behaviors, they become much different. Others might feel like they're being a burden to others. Another one is actually if someone has seemed to be down and all of a sudden like they've changed and are looking really good, and it could be a sign that they are planning and preparing and getting their affairs in order, and once they've actually made the decision, it's a relief for them. If you think someone is at risk for suicide, the best thing to do, first of all, is not panic. Question them, ask them, are you having thoughts of suicide? Be very direct about it because it gives them permission to talk about it. Ask them if they have a plan and if they intend to follow through on that plan. If they do, stay with them. Offer to take them to the closest emergency department or a crisis center if there's one available in the community. If they refuse to go and you are worried that they are going to harm themselves, call 911. There are various programs or means to get assistance. I had mentioned the emergency department earlier for someone who might be in crisis. Primary care providers. A lot of people go to their primary care provider first when they are having thoughts of suicide or experiencing depression or some mental health concern. We have our behavioral health providers here that are more than happy to help assist someone who is experiencing stressors in their life that may include suicidal thoughts. There are other resources in the community, other counseling agencies. We do have a crisis line. There's also a crisis text line and national lines for just national suicide prevention lines. There's also one for veterans. So there are a number of different resources.
My name is Lauren Doust. I'm a therapist for Senior Life Solutions at Door County Medical Center. We are an intensive outpatient group therapy program at Door County Medical Center designed to meet the unique needs of senior adults living with symptoms related to depression and anxiety, issues of grief and loss, caregiver stress, dealing with difficult life transitions, job changes, retirement, and the list goes on. We know, based on current statistics, that there are about 130 suicide deaths per day in this country, and about a third of those are people aged 55 or over. Senior adults who are living with depression are often underdiagnosed or undertreated because they might present with physical problems that are diagnosed as a physical illness, like not eating as much, or fatigue, or chronic pain. And oftentimes, depression isn't treated. And so it is our goal to try to raise awareness to know the signs and symptoms of depression, and also understand that sometimes those warning signs can lead to a person being at risk of suicide. Senior Life Solutions works every year during the month of September to raise awareness about suicide. throughout the country, actually, and here in Door County. We work with Door County Medical Center and others in the community to educate people about what the warning signs are of suicide so that we can all for ourselves know what the warning signs are, and then also to know what to do if you're concerned about somebody that you know, where to go for help, when to seek help, and how to approach somebody if you are concerned.